Chapter 23 is vaccines. So if you use your drug worksheet and follow along, however, they're not going to be in the exact same order of your drug worksheet. The drug worksheet is in alphabetical order as it is in your textbook. I've rearranged them a little bit and put them together. Some of them are vaccines that are together, so I just categorized them a little different. So when talking about vaccines, they're developed because of highly contagious diseases that become a health threat. They have severe symptoms, could cause permanent disability or even death. So these are preventable. So we used to have hundreds of thousands of people die from these diseases, and in some cases, these diseases have been nearly eradicated. The WHO, or the World Health Organization, has lists 25 preventable diseases that vaccines are available for. So the first one is adenovirus. Of course, this is a virus. It causes epidemics of respiratory illness. It is approved only for the military at this time, given to everybody who enters basic training, taken orally in 2 tablets, one-time dose, and it's adenovirus type 4 and type 7 vaccine. Anthrax, there is a vaccine for anthrax. Anthrax is a bacterial infection, causes respiratory challenges. It's spread by spores, can be transmitted through food or touch of an infected animal or clothing. After 9/11, there were terrorist attacks with powdered anthrax, so it's considered a biological weapon. Some military personnel take this vaccine if they're going to be handling animals and animal products. And the anthrax vaccine has a brand name of BioThrax, and it's administered as an intramuscular injection. Next is Haemophilus influenza type B, or high B, or HIV. So when you hear influenza, usually you think of a virus, but Haemophilus influenza is actually a bacteria. It causes severe pneumonia and meningitis in small children. The vaccine's given to infants in 4 doses. They begin at age of 2 months and go for up to the age of 15 months. So within that time, they receive 4 doses. And the name of the brand product is PEDVAX HIB, or PEDVAX HIB, and it's administered as an intramuscular injection. Next are 2 vaccines related to hepatitis. So there's hepatitis A, hepatitis B, and hepatitis C. Hepatitis A is caused by a virus. It's short-lived. Most patients recover. Usually it causes GI distress, diarrhea. The vaccine is given to children in 2 doses between the ages of 1 year and 23 months, and then a booster 1 to 1.5 years later. Hepatitis A mostly comes from exposure to food or water that contains the virus. It's usually contaminated with feces of someone who's already been infected. So in a healthy adult, it's not usually a problem, but in a child, the diarrhea could cause dehydration and electrolyte imbalance and be quite serious. This vaccine is made from an inactivated virus, and the brand name is Haverix or Vacta, and it's given intramuscularly. Hepatitis B is the one that most of you are familiar with. It's also a virus. It's caused or spread by exposure to blood, saliva, or vaginal secretions from an infected person. So through finger sticks, with infected needles, through sexual transmission, this condition can be, disease can be transferred. An acute infection, which sometimes can work itself through with little or no long-term effects, but sometimes can have longer acting chronic symptoms or chronic effect on the liver. So for healthcare workers, they use Energex B or Recombavax HB or hepatitis B, and that's given prior to employment. Most of you, as you go into your professional programs here at Delgado, will be required to have your hepatitis B vaccine prior to starting. The vaccine is given the first initial dose, and then 30 days later, the second dose, and then 6 months later, the final dose. If someone's been exposed to hepatitis B, they may receive hepatitis B immune globulin, which is Gam B, after exposure to the virus. And both of these are administered as intramuscular injections. The next two vaccines are herpes viruses. So herpes varicella is known as chickenpox. It's caused by the herpes varicella virus. It's highly contagious, spread through coughing, sneezing, sharing food, or touching fluid from skin blisters. It's very itchy, so when the patient scratches, they get the fluid under their fingers and their nails, and they touch something, and it can be spread. It's highly prevalent in children, very easily spread. In the old days, kids, it's mostly considered a childhood disease. However, it can be very serious if an adult contracts chickenpox. So the chickenpox vaccine came out, I believe, in the late 70s, and children between 12 and 15 months of age should receive this. And the varicella vaccine or chickenpox vaccine has the brand name of Varavax, and it's a subcutaneous injection. Now, patients who've had chickenpox, the virus lays dormant in the body and at a later time can become reactivated as the herpes zoster. So zoster is shingles. So shingles occurs in patients who are 50 or generally patients who are 50 or older. It can happen younger, stress, immune compromised patients, but shingles vaccine is given to patients 50 and older unless their doctor has indicated otherwise. For people who've had chickenpox, they're at risk for developing shingles. So the herpes varicella zoster vaccine is called Zostavax, and it is also a subcutaneous injection. The human papillomavirus causes warts. So this virus is very common in almost all sexually active adults. There's more than 40 different strains of HPV, and many cause genital warts, which can develop into cervical cancer. It can cause throat cancer in patients who've had persons who've had oral sex, and it can cause pineal cancer, pineal warts and cancer. So very serious. The vaccine is recommended for boys and girls ages 9 to 26. And you might think, wow, 9, that's pretty young. But the way this vaccine works is it takes several years to get to its full potency. So giving it younger, they get the full potency by the time that they're sexually active. That's also why it's not really given to anybody outside of their mid-20s, because by that time, if they've not had the vaccine, chances are that they've been exposed to HPV. The vaccine is given in 3 doses. It's given as an intramuscular injection, and then there's 2 types of vaccines for HPV. Cervarix is a bivalent, which means it contains protection against 2 types or 2 strains of HPV, type 16 and 18. And Gardasil is quadrivalent, so that's for 4. Most commonly causes of cervical cancer, type 6, 11, 16, and 18. Next is the flu vaccine. So the flu vaccine, you probably hear about this every year, especially in healthcare. It's important to have the flu vaccine. Viral respiratory disease, it's contagious. So most people think, the flu, nothing major. But it's more about the complications. So you can develop bronchitis, pneumonia, and patients who have breathing conditions like asthma or COPD. It can be a risk for small children and the elderly. It can be a concern. So there's 3 types of influenza, A, B, and C, and the types that are treated with a vaccine are types A and B. The CDC recommends annual vaccination or immunizations beginning at 6 months and continuing through a patient's lifespan. So how do they determine the vaccine? It changes every year. So the viruses will continually mutate. So to reformulate, every year the CDC evaluates what has been the occurrence of flu in Asia and takes the prevalent strains and creates a flu vaccine in the US. And then patients get a flu shot. Now, because they can't cover every strain, then some patients could still get the flu even though they've had a flu vaccine. So the influenza vaccine, its type is based on the patient's age, if the woman is pregnant, and if the patient has an allergy to eggs. So Fluzone, high dose, is recommended for patients over the age of 65, and it's because it's got a more concentrated, a higher amount, and the patients over 65, their immune systems are not as healthy as a younger person, so this helps boost their immunity. It contains 4 times the number of inactive viruses. Influenza vaccines are given intramuscularly with the exception of Fluzone intradermal, which is given intradermally, and FluMist, which is given by nasal spray. So the brand names for type A and B influenza vaccines include Fluvarex, Flublock, FluMist, Fluvarin, and Fluzone. The meningococcal meningitis, it's caused by bacteria, Neisseria meningitis. It causes inflammation of the brain and spinal cord, can result in loss of hearing, kidney damage, damage to the nervous system, and death. So this is quite serious. It is a bacterial infection, highly, highly communicable, and entirely preventable. So this disease can cause death to a child in 24 hours. The recommendations for the vaccine are that adolescents between the age of 11 to 16 is the first injection, and a booster is given at the age of 16. Highly recommended for college freshmen who live in dormitories and for persons over than 55. And they can be given a different vaccine that's called Menimune. The meningitis vaccine is brand names are Menactra, Menimune, and Menveo, and they're all given intramuscularly. The pneumococcal pneumonia vaccine. The pneumococcal pneumonia is caused by bacteria Streptococcus pneumoniae through coughing and droplets left in the air, causes respiratory. It's the leading cause of respiratory illness in the world. It can cause pneumonia, meningitis, sinusitis, and ear infections, especially in children under 5. The recommended vaccination for children is for the conjugate vaccine PCV13. It causes a longer lasting immune response, and 4 doses are required between the age of 2 months and 15 months. For adults, if the adult's 50 or over, they should receive the pneumococcal polysaccharide vaccine, which is PPSV23, especially if they're in a long-term care facility. The pneumococcal conjugate is known as Prevnar 13, and the pneumococcal polysaccharide is known as Pneumovax 23. Polio is a virus. It's also known as poliomyelitis. It's a viral disease of the spinal cord. It causes weakness, paralysis, can affect breathing by paralyzing the diaphragm, and can result in death. The vaccine is comprised of 4 doses of killed inactivated polio virus from 2 months to 4 years. The 4 doses are administered over that 2-year span, and it can be given subcutaneously or intramuscularly, and the brand name is IPOL. Rabies is a disease that's carried by dogs, cats, and other mammals. It is viral. The virus causes inflammation of the brain and spinal cord, results in seizures, and is fatal to humans and animals. Rabies immune globulin which is brand name Hyper Rab SD, or Imogam rabies HT, is given subcutaneous or intramuscular around the area of the animal bite. The rabies vaccine is Imovax or Rabavert and is an intramuscular injection. Next is rotavirus. It is a viral illness that causes fever, vomiting, and severe diarrhea. It's highly contagious. The first vaccine became available in 2006. 3 doses are given at 2, 3, and 4 months of age. And this is an oral liquid vaccine, so it doesn't require injection. The rotavirus vaccine has the brand names of Rotarix or Rotatec. Now the next couple of slides are about combination vaccines. So the next 2 vaccines have a combination of multiple vaccines in them. So the first one is the DTP or DTaP, diphtheria, tetanus, and pertussis vaccine. So diphtheria is a bacterial infection. It causes a respiratory disorder, highly contagious, causes high fever, swelling of the throat, and can cause heart or nerve damage. Tetanus, which is also known as lockjaw, is caused by bacterium Clostridium tetani, and generally it's caused by the toxin from this bacteria that the bacteria gets introduced into the body through a wound, usually in an unsanitary cut, like stepping on a rusty nail or something like that. And it's the endotoxins that cause the problem of the lockjaw. Pertussis is known as whooping cough, and this disease causes respiratory distress and severe coughing. It has a very distinctive sound to it. It's choking. It causes spasms in the larynx, the voice box. So diphtheria and pertussis are also communicated through coughing. Vaccine for these 3 conditions requires 4 doses between the ages of 2 months and 18 months. Pregnant women should be advised to obtain the vaccine in their 3rd trimester of pregnancy, and that's mostly because of the pertussis. Pertussis can be spread to a newborn baby because they can't be vaccinated until at least 2 months of age, and it can be quite serious if a baby gets this. So the vaccine itself is diphtheria, tetanus, pertussis, or DTaP vaccine, and its brand names are Adacil or Boostrix, and it's given as an intramuscular injection. Next is the MMR vaccine, measles, mumps, and rubella. So measles, now I'm making a correction because your book has this incorrect. Measles are known as rubeola. Your book lists it as rubella. Rubella is German measles. So measles or rubeola, it's highly contagious. It's caused by a virus. It has symptoms of a high fever, a hacking cough, and a red rash. Mumps are also highly contagious at causing swelling of the salivary glands, which can cause, and the virus can cause inflammation of the brain, loss of hearing, swelling of testicles in boys, and if mumps is contracted in an adult, it actually can cause sterility. The 3rd disease that's in this vaccine, or that component of this vaccine, is rubella, which is the German measles. And all 3 of these are contracted by air droplets from cough. So measles, mumps, and rubella are all kind of airborne exposure, and actually can be up to 2 hours after someone has coughed. Somebody else can walk through and could actually contract. Rubella is an upper respiratory infection, can cause birth defects in a fetus when the mother is infected, and miscarriages in 20% of pregnancies where the mother has contracted German measles. So it's very important that the mother is vaccinated, or if they're around people, that they have been vaccinated so that the mother doesn't contract, especially the German measles. This vaccine is advised to be given at 1 year to 15 months of age, and a booster given between 4 and 6 years of age. It combines the rubella, measles, mumps, and rubella vaccines all together, and that's known as MMR2 or ProQuad, and that's given as a subcutaneous injection. The newer one actually also has measles, mumps, rubella, and varicella for the chickenpox. Now, as far as other vaccines, cancer vaccine, there's one. It's the only vaccine available for cancer, and it's used to treat, not prevent, prostate cancer. So it's Sipuleucel T, or Provenge, and it's given intravenously in 3 doses, several weeks apart. Now let's talk about immunization schedules. So the CDC has guidelines for appropriate scheduling of these vaccinations. A few things. Vaccines have been proven not to be related to autism. Also, for many of the vaccines, patients who need a vaccine can go to a pharmacy and be vaccinated. Pediatricians are some of the only doctors that still may do vaccines in the office. Most of your doctors are going to send you to the pharmacy. Does not necessarily require prescriptions, as long as the pharmacy follows the CDC protocol. However, a doctor may write a prescription because it would get handled under their insurance. So in your book, there's some diagrams of the schedules. So this is a children's immunization schedule from 2014 that says when they can get their first vaccinations. Now, the majority of the vaccinations in children start at the age of 2 months. The only difference there is the hepatitis B vaccine. Most of the child's protection will come from breast milk if they're being fed breast milk and is passed on from the mother. This is also why some moms don't really take their babies out for the first 2 months, because they could potentially, especially when it's flu season or a high epidemic or pandemic type time for certain illnesses. Then the adult immunization schedule. This is for childhood immunizations from birth through 18 years. So it also makes note of boosters. Here's the adult immunizations. So the thing, as adults, we should get our flu vaccine every year, and the DTaP booster about every 10 years, primarily for the tetanus. Varicella requires 2 doses to prevent shingles. So most vaccines, preventable diseases are nearly controlled because vaccines are between 90 and 99% effective. However, a vaccinated child can still occasionally get a disease. Generally, that will occur if their body does not build the immunity. They haven't had enough time for the immunity build from the time that they received the vaccine to a point where they're exposed, or if they have immunocompromised conditions, like cancer treatments and things like that, things that have suppressed their immune system. So that's more of a concern, which is why other kids have to be vaccinated, because if another kid isn't vaccinated and they're a healthy kid and the mom's like, oh, they're healthy, so if they get this, it's not going to be a big deal, but they get it and they go to school before they know they have it, and they give it to a child who's immunocompromised and can't get the vaccine, it could be potentially life-threatening to that other child. So those are some of the concerns with what we call those anti-vaxxer patients. So this just goes on to say that. Now also, traveling to other countries where diseases may be prevalent that have pretty much been eradicated in the United States. So if we think, oh, there's no cases of polio in the U.S., but we have people that come from other countries that can still bring in these diseases. So again, it's about protecting ourselves. Without vaccination, many of these diseases are quite severe and even fatal.